So in the slide deck, there's a quick summary of my profile. What we'll do is we'll do a quick welcome and introduction. I want to talk about healthcare driving some trends in AI, talk quickly about data within healthcare, look at some aspects of what we can do forward, and close off with any questions, comments, and discussion. If you have a question, please type it into the chat, and I'll try and address them as we go through, as well as at the end. So what I want to talk about very quickly is the importance of data within healthcare and how it works across all the different areas of healthcare. Most people on this call are very familiar with this, but I do want to highlight one important thing: the use of paper records. In hospitals, they are still driven, especially in Australia, by paper records. So our take-up of data and AI is going to be impacted by how we do the processes and how we digitize and how we're able to use patient records and paper records. So healthcare is actually a major driver of trends in AI, and I want to very quickly cover off some of the key trends that we are currently experiencing. What we're seeing is that markets are a little bit chaotic and dysfunctional, and the regulatory tends to lag. Let's not worry about the hype around the investments. There's a lot of hype around jobs, and the reality is very different. Some of the investments are still to be realized, especially within businesses and especially within government operations and within healthcare for a variety of reasons, which we'll talk about quickly. The business uptake is not matching the hype, and the regulatory side of AI is variable, but it will catch up. And as healthcare and healthcare professionals, the regulatory side is very important to everything that we are doing. Now, another quick point is that as a business, you need different types of AI to work together. So whether it's robotics, imaging and facial recognition, IVR and ChatBots, generative AI, whether it's a lot of high content, AgenticAI with its process flow, and the aspiration of artificial general intelligence, you need these different AI types to work together. And this is a gap we see within healthcare. Healthcare is driving to close the gap, and it is a gap we see within the market. Now, I want to quickly do a quick map, and I'm not going to get into it in any detail. I want to just paint a picture. Yes, the USA leads in generative AI and agentic AI, but if you look at other areas of AI like robotics, it's Japan. You look at chips, it's Taiwan. China leads in many other areas. If you look at things like data protection, the EU is a leader of it. If you look at the AI used in food production, Holland is the leader. So that leads into where we are with healthcare and the take-up of AI. What we're seeing is that where countries have a strong healthcare system already, where they are addressing data access, data management, records management, and those sorts of aspects, they are leading in the take-up and adoption of AI within healthcare. So things like the regulatory frameworks, what governments do, data management, are seeing leadership in the integration of AI across healthcare, and the US is not a leader in this space. Some of the emerging ones are India. China obviously has a leadership. Some of the other leaders are like the UK because it has a very strong healthcare system already, and Singapore, where it's got very strong record management. So again, take up of AI in healthcare is being driven by other aspects like government policy, data, and those aspects. Now, what we see within healthcare is a drive towards sovereignty of data, models, data centers, and those sorts of things. We're seeing specialist needs with business integrated offerings, smaller data models, specific data sets tailored to specific needs. Healthcare is driving the embedding of AI with chips and devices and in applications, and healthcare is driving safeguards, business trust, regulatory, and those sorts of things in many areas of AI. And there's a little bit of a battle we see between a one-size-fits-all versus highly specialized offerings. We all know that the AI we have for growing lettuces is different for the AI to control fighter jets. Let's skip on because we'll run out of time. Want to very quickly talk about within healthcare, we need to get information out of legacy systems, use the cloud services, and of course, we've talked about the paper records. We need to integrate systems. We need to integrate error types. We need better management of errors and exceptions. Of course, we need permissions, access, authentication, privacy, and all of those aspects. And the whole thing needs to be encrypted. Currently, China is the leader within this kind of layered approach within AI. India is moving along this path. The UK is moving along this path, which is very different to what we see within the American approach to AI. And as we said, the market will take it out. Now, one of the big issues, especially seen within healthcare around AI, is cybersecurity. AI brings more attacks. The attacks are occurring faster, of higher frequency, of extended vulnerability, greater duration, of increased complexity. So what we're seeing is cyber attacks go after backups first, because backups are more vulnerable. They stop the access to the backup. They then attack the main system. So you can no longer just recover from backup. There's been a couple of healthcare examples where this is manifested through, and of course, there's greater exposure. But the big one is the human factor is needed more and more to manage cybersecurity. Let's quickly look at some aspects around data within healthcare. Please put your chat in the comments in the chat as we go through. Within healthcare, we have to look after the metadata, structured data, the databases, the unstructured data, the Word documents and emails, images and videos, the spatial data, but we do a lot of blended products, we do a lot of derived products, and within AI, there's an increasing use of synthetic data, which can be a contamination. There's a growing wave of cyber attacks whereby they attack the data within the AI models so that you'll get results. Now, we obviously have to have some level of governance, and one of the big issues and one of the challenges we see within healthcare is who has ownership and how do we manage the dependencies and ownership of the dependencies. So we need data, practices, algorithm, roles and responsibilities, how we provision everything, oversight, safeguards, products and services, and some level of governance. I'm not going to go into this too much because we're a short presentation. So in the slide, when we share it, you can see many of the areas that underlie these key themes within data and AI governance. The one bit I want to pull out is trust. The New South Wales government passed data legislation about 6 or 7 years ago. At the time, it was a great success, and it's been a success since. The biggest factor impacting the sharing of data is trust. Do I trust the source of the data? Do I trust you to do the right thing with the data? They've done education and training. They've done legislation. They did a report 18 months ago, and the biggest impact in the sharing of data within healthcare, within New South Wales, for AI, and just across the board is trust. So if our AI and our data practices are undermining trust, this is one of the challenges we'll need to work our way through. Now, when we share the slides again, there's some couple of areas to look at: accreditation, certification, skilling and training, having standards and guidelines. All these help with trust. One of the big ones is the service agreements we have across our supply chains and logistics chains for the sharing of data. Non-healthcare example, famous Middle Eastern government outsourced visa processing to a family friend company. They went bankrupt. They left all the data in the data centers. They got hacked. They had to stand up a huge task force to manage visa fraud. So one of the challenges within healthcare is driving the service agreements and making sure that the agreements are in place for the sharing of data with the appropriate fines, penalties, performance management, and those sort of things, because not only does it impact the performance of healthcare, but it also cascades back on the trust factor. So what we do has an impact. So what are the things that we can start to do to make it all real? One of the big ones is having the prerequisites required. As we saw on the world map, the take-up of AI and data was very strong in the UK because it has a very mature healthcare system with a lot of prerequisites built in. If you look at some other countries that have less mature healthcare systems, they have less business prerequisites built in, and this is slowing down the impact of AI and the take-up and use of AI. Now that's an area that we need to address. And healthcare is driving this in many countries, such as Singapore. Within its data governance and its AI governance within healthcare, it's encouraging project management capabilities. Now, we need to include data and AI within the different courses that we teach and learn. So whether you're doing a specialist medical course, whether you're doing a course in IT software design, these data practices, data principles, and AI aspects need to be included within the courses. This is a challenge that Australian universities are still seeking to work their way through. We've talked about cyber and the importance of it. Now, one of the issues, again, we face within healthcare within Australia is cybersecurity is seen as an IT responsibility off to one side. It's not treated as a whole of business management issue and a whole of business response. So what we're seeing is that people are putting AI agents onto their devices. They're getting hacked and they're extra points of vulnerability. What we're seeing is government agencies are cancelling the use of bring your own devices and going back to agency issued devices within specific regimes and standards, so that you cannot just use shadow IT and you cannot just put AI agents and leak data out and those sorts of things. It's been doing for cyber, it's been doing for wider business returns. So we need to make sure that these aspects get included both within schools, TAFEs, universities, and private colleges. The accreditation and certification regimes need to be revised so that doctors within healthcare are aware of these sort of things, but the finance people within healthcare understand these things. We've talked about service agreements. We'll skip that one. One of the biggest challenges is the professional skills, problem solving, and the working with stakeholders. All of these skills become more and more important as we use greater use of data and greater use of AI. And one of the ones, especially within healthcare, is those involved in the hiring processes need to not only be skilled up on healthcare and healthcare management issues, there is this need for skilling on data and AI practices, cybersecurity, and those sort of things, because they influence the skills and expertise coming into organizations. They're educating HR people and hiring managers through business scenario sessions is something that we can do. Now, there's in the pack, there's 3 slides of links to further information. I've picked a India slide to wrap up because we started with Australia. Conscious of time, we've got about 10 minutes left, 5 minutes left for questions and comments. And I realize we've covered a lot of ground at a high level very fast. So please bring your questions and comments in, please. Madam Chairman, back to you.
Thank you, Dr. Kate. That was really an outstanding presentation. So right now it's time for questions. If anyone have any questions, please unmute your mic and ask your question to Dr. Kate.
I think there's a gentleman, he's on mute.
So, okay. If
Dr.
anyone have any
Vinod?
questions?
Yeah,
please.
It's excellent talk on AI. I just, Keith sir, I wanted to know what will be the future when robots get involved in this? Because robots are now working on AI, and then they say that there is no importance to doctors. Doctors will be just managers.
How should we describe that one? There was a very eminent software engineer that used to own one of the biggest software companies in the world, and he said there's going to be no need for doctors. Let me just answer your question this way. We know the hype, we know the reality. The reality right now is that a robot can change a sheet under a patient. Yet, we do not see large-scale applications of robots in hospitals, hotels, nothing. Because you have to get the patient to lay there in a particular way for the robot to change the sheet. So, robots are used in surgery. Robots are going to have a key role to play. We still face the importance of the human factor, working with humans, and the integration of AI types. Sorry, doctor. Please go ahead.
Yeah, because in India, as you said, many people doctors are now using robots, especially for arthritis problem, and then for other lesser surgeries and all. So they say that the importance of doctor might come down. That is why I just asked.
I think that there's a lot of uncertainty. We don't know how this is all going to pan out. We see very clear trends like the integration of AI type. We see the role of robotics. We see that the human factor is going to be important. We see the need for greater skilling. We see data impacting the take-up of AI and all of those sorts of things. Yes, we like to get our crystal ball out and make predictions and that sort of thing, But I think we can be very clear on the fact that doctors are not going away. And Dr. Vinod, I'll give you a quick example. You have doctors in India who have to get into four-wheel vehicles and canoes to run general surgeries in, I wouldn't call them remote communities, but communities outside of the major cities. So you tell me how AI is going to do that and how fast it's going to do it. That's a rhetorical question, Doctor.
The thing is, in all big hospitals, because these hospitals are almost in India also some international hospitals like Apollo, Jupiter, and so many. And there they have all the facilities now of this robot and AI both. And then therefore the doctors they have started using this robot for, especially they started with osteoarthritis of the knee joints, but now even for doing laparoscopy also they say that we are going to use robot. One of my friend who is 78-year-old yesterday told me that I wanted to use robot for, because he is doing laparoscopy for last 40 years. But he said now I'll do it through robot.
Yep.
So,
And can I ask you, sorry, can I ask you, with your friend, when the patient is wheeled in to surgery and put anesthetic, are they managing the entire process off a iPad, or is there a paper file at the bottom of the patient's
I don't know the details, but they have
bed?
already, they have already used it in 3 patients.
Yeah. So you're absolutely
Laparoscopy
right. The trend is greater use of AI, absolutely integration, but we're talking about some of the challenges that are going to be there and are impacting right now in the use and take up. And Doctor, I think you would agree with me. There's a big difference between the hype and the reality on the ground. Yeah. Madam Chairman, do we have time for one more question?
Yes, sir, you can do that.
Right.
We
Are
have
there any
2 more
more
minutes.
questions?
Yeah, if still anyone have any questions, I kindly request you to unmute your mic and ask your question to Dr. K. We still have 2 more minutes. Okay, Dr. K, it seems like there are no more questions. Dr. Vinod, if you have any questions, please unmute your mic.
Only one comment.
Yeah.
That one of my friend was doing laparoscopic surgery on through robot, and he saw there are some extra arteries from the liver. So he said that only robot cannot do the surgery. Doctors has to be involved because many times AI misses these extra arteries and ligation of these arteries. So that is what
Yep,
he was telling.
correctly.
Just
And
a
that's
comment.
exactly the change that we're working our way through. And me, I'm a passionate advocate for AI and use of robotics and those sort of things, as you can tell. But where we're coming from is the proven, pragmatic, practical realities that need to go with it. And just to finish up, healthcare is driving aspects of cybersecurity. Healthcare is driving aspects of record management. Healthcare is driving this push from the one-size-fits-all AI to the specialist models tailored to specific needs using highly customized data sets to do specific functions. I'd love to take more questions and comments. I'll share the slides. Thank you very much indeed for your time. Thank you for listening. Thank you for your questions. Madam Chairman, back to you.
Okay, moving on to the next presentation.